13,000 people die in American nursing homes every single year because there are not enough staff to care for them, and the only federal rule that was going to fix that just got delayed until 2034, which means for the next 9 years, nobody is legally required to make sure enough nurses show up to the facility where your mother, your father, or your spouse is living right now. That is not a statistic pulled from an advocacy group's fundraising email. That is University of Pennsylvania research combined with an enacted federal law that has already been signed, already scored by the Congressional Budget Office, and is already triggering warning letters to families in nursing home lobbies across this country. If you have a loved one in long-term care today, or if you are over 55 and have not yet made a concrete plan for how you will pay for care if you need it, you are about to hear the most important explanation of your financial and medical future that anyone will give you this year, and it begins with a mistake that 4 out of 10 Americans are making right now. They believe Medicare covers long-term nursing home care. It does not. Medicare pays for a maximum of 100 days of skilled nursing following a qualifying 3-day hospital stay. After 100 days, Medicare coverage ends completely. You can verify this yourself at medicare.gov. After those 100 days, the only program that pays for custodial, long-term care for most Americans is Medicaid. And what just happened to Medicaid affects every nursing home bed, every home care program, and every family counting on that coverage to keep their loved one safe and cared for. The law is called the One Big Beautiful Bill Act, officially H.R. 1, Public Law 119-21, signed July 4th, 2025. It runs over 900 pages. The Congressional Budget Office confirms it reduces federal Medicaid spending by $911 billion through 2034. AARP verified this. KFF confirmed it independently. Medicaid currently pays for more than 60% of all nursing home residents in America. There are approximately 1.2 million people living in nearly 15,000 certified facilities, and in 2023, Medicaid covered 44% of the $147 billion the nation spent on institutional long-term care. KFF polling shows 4 in 10 adults incorrectly believe Medicare is the primary payer for nursing homes. That misconception is the most expensive mistake a family can make when someone they love needs care, because by the time they discover the truth, they are already facing $8,700 a month with no coverage and no plan. Consider what is happening right now to real families. A 67-year-old retired teacher in Pennsylvania placed his wife in a facility last September after her Alzheimer's made home care unsafe. Medicare covered the first 100 days and stopped. The monthly cost is $8,700. His income is $3,200. Medicaid was approved. Then a letter arrived warning about federal funding reductions and possible staffing changes. Nobody connected that letter to a specific law or explained its meaning. Here is what the law does. The first provision suspends nursing home staffing standards until October 2034. In 2024, the government finalized rules requiring a registered nurse on site around the clock, plus 3.48 hours of direct nursing care per resident daily. The new law delays all enforcement for nearly a decade. CBO scores this at $23.1 billion in savings. KFF confirms fewer than 1 in 5 facilities currently meet all 3 minimums. 13,000 annual deaths from inadequate staffing will continue without federal intervention for 9 more years. The second provision caps home equity for Medicaid eligibility at $1 million starting January 1st, 2028, with no inflation adjustment ever. Previously, states set limits above $1 million with annual adjustments. In markets appreciating 3 to 5% yearly, homes worth $800,000 today cross $1 million within 5 to 8 years without the owner taking any action. Exceeding the cap eliminates Medicaid eligibility for nursing home or home-based care unless the property is sold or equity reduced below threshold. The third provision cuts retroactive Medicaid coverage from 3 months before application to 2 months for traditional enrollees and 1 month for expansion populations. At $8,700 monthly, each lost month creates immediate debt during emergencies when paperwork cannot be completed quickly. The fourth provision requires 80 hours monthly of work or volunteering for Medicaid recipients ages 19 through 64. 9 million people between 50 and 64 face this. CBO estimates 5 million will lose coverage, 1.8 million of them aged 50 to 64. States must implement by January 2027. The fifth provision freezes enrollment simplification rules until October 2034, resulting in 1.3 million fewer dual-eligible beneficiaries. Someone earning $967 monthly would pay $185 in Medicare premiums, 20% of their income. The sixth provision restricts provider taxes used by 46 states to fund Medicaid. New taxes prohibited, increases banned, state payments limited. 29 states must reduce facility payments. Less money means fewer staff, means more harm. The seventh provision cuts SNAP by $186 billion while extending work requirements to age 64. 8 million seniors currently receive SNAP. 900,000 will lose food benefits, and the law accelerates Social Security insolvency through permanent tax cuts that reduce trust fund revenue. The 2026 Trustees Report Projects. Fund depletion, Q4 2032, triggering automatic 22% benefit cuts for all recipients. Despite everything above, protections remain, and they are usable today if you understand them and act before deadlines pass. Medicare's 100-day skilled nursing benefit is unchanged. Medicaid applications can still be filed at any time, and states must process them. Denial triggers fair hearing rights. Spousal impoverishment rules protect the community spouse, allowing retention of between $30,828 and $154,140 in assets plus the home. States can maintain higher coverage independently. Congress retains power to modify or reverse every provision. These protections are real, current, and enforceable, but only for those who know they exist. 3 actions this week. First, contact your state Medicaid office through benefits.gov or call your local area agency on aging. Learn your state's home equity limit, income thresholds, and any protections exceeding the federal minimum. If anyone in your family could need nursing home care within 3 years, begin Medicaid planning now with an elder law attorney before the January 2028 cap closes options that are currently open. Irrevocable trusts, Medicaid-compliant annuities, spousal asset transfers, and retirement account positioning remain available today. Each becomes less effective or unavailable once its specific deadline passes. An attorney evaluates your assets, your state's rules, and your timeline to identify exactly which tools apply. Every month you wait is a month of narrowing options that cannot be recovered. Second, verify your facility's staffing and financial health. Use Medicare's Care, Compare at medicare.gov to review staffing hours per resident, inspection results, citations, complaints, and quality ratings for your specific facility. Compare current numbers to 6 and 12 months ago. During visits, count staff on the floor. Time how long call lights go unanswered. Ask your loved one directly whether wait times have increased for bathroom help, medication, meals, or basic check-ins. Document observations with dates and times in a dedicated notebook. Report concerns to your state's long-term care ombudsman, which investigates at no cost. Meet with the facility administrator. Ask whether Medicaid reimbursement reductions are anticipated, how they will affect staffing, and what contingency exists for residents if services change. Get written responses. If the trajectory concerns you, research alternative placements now while quality beds remain available and before competition for them intensifies as more families reach identical conclusions. Third, contact your elected representatives within 7 days. Congressional Switchboard 202-2243121. Find your senators and representative at congress.gov. Identify yourself as a constituent. State your concern about $911 billion in Medicaid cuts and their direct effect on nursing home staffing, care quality, eligibility standards, and food assistance for seniors. Ask whether the member supports restoring adequate funding, accelerating staffing enforcement instead of delaying until 2034, adding inflation adjustment to the home equity cap, and protecting SNAP for older Americans. Calls take 3 minutes. They are logged, counted, and compiled in reports to the elected official. Sufficient volume on a single issue moves it from ignored to priority. This is the mechanism. It requires only that people use it. One clarification prevents an expensive error. Owning a home does not disqualify you from Medicaid under current rules. Your primary residence is generally exempt as long as you, your spouse, or a dependent relative lives there, or you maintain intent to return. The equity cap applies only when home value exceeds the threshold. Currently, that varies by state up to 1,097,000 adjusted annually. After January 2028, the uniform cap becomes 1 million flat permanently. In any appreciating market, this creates a silent timer. A home at 850,000 growing 4% yearly reaches 1 million in under 5 years. Families who feel safe now may discover market appreciation alone has disqualified them without any action or awareness on their part. Planning before 2028 is not premature. It is the only window in which certain strategies remain legally available. After the deadline passes, those tools either become restricted or vanish entirely. There is no retroactive remedy for a missed deadline. All information is sourced from CBO Publication 6157. O. The text of Public Law 119-21, Medicare.gov, the 2026 Social Security Trustees Report, an independent analysis from KFF and AARP. Every figure is publicly verifiable. This content is educational only and does not constitute legal, financial, medical, or tax advice. Medicaid rules vary by state and individual circumstances differ. Consult a qualified elder law attorney, certified Medicaid planner, or your state Medicaid office before making eligibility or planning decisions. If this gave you information you needed but did not have, act on it immediately. Think of everyone you know with a parent in care, a spouse declining in health, or property appreciating toward a threshold they have never heard of. Send this to them now. The families damaged most severely by policy changes are always those who learn about them after options have closed. Make sure yours is not among them. Share your state and your situation in the comments. Every response helps others in identical circumstances find the answers they need. Subscribe with notifications active so every deadline, state update, legal challenge, and protection strategy reaches you the moment it is available. $911 billion is already gone. Time is the only resource that remains, and it is disappearing whether families are paying attention or not. The Retirement Desk,